So people with skin conditions are actually a very vulnerable group because skin conditions are largely visible, at least to the individual, and they can be visible to other people, for example, a partner or a family member or somebody that you're close to, or even somebody that's a member of the public, because skin is on show. Sometimes people feel that they are able to comment on it or they have the right to comment on it. And this is why psychology becomes so important. So, what we know is that psychological distress can drive skin conditions, and this causes further psychological distress, and it can become a vicious cycle. In psychodermatology, what we like to do is we like to treat the skin, we like to treat what we can see, and at the same time, we like to treat the psychological impact that it's having on that person. In psychodermatology, we see, or I see, two main groups of patients. Either those patients who have primary dermatological disease that has psychological or psychiatric comorbidity. So that means, for example, somebody who has psoriasis, which is largely impacted by stress and can cause somebody to become depressed or anxious, or eczema, which is very much driven by anxiety, and even issues like hives or rosacea or having acne. I also see people who have a primary psychiatric condition that are seen in dermatology. So those are those people who may have body dysmorphia, or they may have obsessive compulsive tendencies like skin picking behaviors or acne excoriae where they're picking their acne, or repetitive hand washing or nail biting. So these are some of the conditions that we see in psychodermatology. The way that we see the link happening is that when people have any type of skin condition or any type of skin concern, they can become psychologically impacted by it. It can affect their ability to socialize, their ability to complete their activities of daily living, and also important lifestyle sort of milestones as well. So things like having a relationship, or going out and getting exercise, or even choosing the right food for themselves because they don't feel confident in their own skin. And this is how the two can be related. In my practice, I see all types of skin conditions, and I always look at every patient as a possible psychodermatology consultation. And that's because I know the impact that skin conditions can have on how somebody feels. The way to diagnose a psychodermatological skin condition is to actually have a long and lengthy discussion with the patient. So typically psychodermatology consultations are much longer than a usual dermatology consultation. And during the consultation, apart from talking about the skin, hair, or nail issue that the person has, we will also talk about other important topics. For example, are you sleeping? How is your mood? Do you feel tearful? Are you able to exercise? Are you in a relationship, or would you like to be in a relationship? What's happening at work or at school? Are you able to concentrate? So we're really getting a holistic assessment of the person. And when I can see that no matter what the condition is, it is psychologically impacting that person and it's impacting their ability to achieve the things they want to in life, that's where I adopt a psychodermatological approach. When we treat people in psychodermatology, of course, most important is to treat what we can see and the condition that they have. So they still receive all the relevant medical treatment that they need for their skin, hair, or nail condition. So, for example, if you have eczema, you will receive the right treatment for that, including creams, including tablet treatment, and even injectable treatments. In addition to that, once I've made an assessment of the psychological impact on that person, then I will offer supportive treatment. And that can be anything. So that can simply be our consultation. So being able to talk about your skin in the way that you want to talk about it, taking the time that you need. It can also include psychological interventions. Now, this doesn't always have to be something that is led by somebody else. So psychological interventions can include, for example, talking therapies. But you can do that yourself. You can engage in something like mindfulness, or you can engage in meditative practices. So you can engage in yoga or walking meditation, or even things like shower meditation. So I will teach people how to focus on the moment rather than focusing on the negativity that clouds their mind for most of the day. Of course, in some cases, there will be people who have got clinical levels of anxiety or depression, and in those cases, it is possible to prescribe oral medication. Anybody will benefit from seeing a psychodermatologist. And that's because I really believe in providing this very holistic approach to your treatment. You don't have to have anxiety and depression as well as a skin problem to see a psychodermatologist or to benefit from that approach. If you're interested in discussing the effect of your lifestyle on your skin, hair, or nail issue, or you want to just talk more about what it means to you, then you would definitely benefit from a psychodermatological approach.